Good afternoon and welcome, and thank you for coming out, so to speak, to the City Club of Cleveland today. I'm David C. Barnett, senior reporter and producer for WCPN. I'm pleased to be here during National Coming Out Week to facilitate a conversation about fostering inclusivity in the workplace. As a society, we've made some dramatic progress in providing equal rights to individuals who identify as lesbian, gay, bisexual, and transgender. But despite this changing social and legal landscape, a study conducted in 2013 by the Human Rights Campaign shows that over half of all LGBT workers nationwide still hide who they are at work. Why do you suppose that is? Well, while many companies have embraced equality in the workplace, offering inclusive benefits and diversity practices and establishing non-discrimination practices, our nation's federal protections against discrimination are lagging. For example, while same-sex marriage is now legal in 28 states, 28 states don't offer full non-discrimination protections to all LGBT employees, which means that companies in these states still have the authority to fire employees based on their sexual orientation. The cost of being in the closet at work are significant. They affect employee engagement, productivity, and retention. In order to promote a more inclusive environment in the workplace, many corporations and organizations form what's known as Employee Resource Groups, or ERGs. They provide community engagement, a safe space for underrepresented groups. There are ERGs for African Americans, for women. One group even has one for veterans. ERGs that we're discussing today focus on the retention of LGBT and allied employees, but can also support business opportunities with LGBT consumers and other initiatives. In Northeast Ohio, many corporations have embraced their LGBT and ally resource groups to enhance talent retention and provide inclusive workplaces, and today we're about to hear their experiences, good and bad, in creating a more inclusive workforce. And with that, let's get started. We're going to introduce you to each panelist per the standard City Club format. Employee engagement is a very significant and important thing that we want to talk about. And we are going to talk to people. We've got a couple of Kellies here. You see, I'm a radio guy and I'm used to scripts, so, you know. We've got a couple of Kellies here, one with I'm good. We've got a LLY and an LLIE here, so we will make that discrimination. Kellie Hancock, she's Executive Chief Nursing Officer of Cleveland Clinic Health System. And Kellie Rubesne, Senior Counsel at Progressive. And then we have two gentlemen from the banking industry, Paul Clark, Regional President of PNC, and on the end, Jason Rudman, who's Director of Consumer Payments and Digital Banking at KeyBank. So what I'm going to do is ask each one of these folks to tell you a little bit about themselves. We'll get a sense of them, and then we'll ask general questions, and we're going to have a discussion here. And so we'll talk for about a half hour. Dan will take back over for some mid-show questions and items and issues, and then we'll open it up to you folks, okay? So, first of all, Kellie Hancock, yes. Tell me, what led to the creation of the clinic's Employee Resource Group?
So, you know, we have at the Cleveland Clinic, so we have 11 employee resource groups across our entire health system. So, to put it in perspective, we have about 43,000 employees, and we have 11 of these ERGs, so don't ask me to name them all. But when we look at the importance of an employee resource group, you know, I look at it really as a unique opportunity. It's really a unique opportunity to provide networking and engagement of caregivers, and that's what we call our employees at the clinic, to really connect that have a familiar or similar background. And they really have a power, a dynamic force, really that allows them to be organizational champions in the mission of creating and sustaining a culture that's inclusive.
Then we have Kellie Rubesne. How long have you had an ERG? What were its origins?
So I work for Progressive Insurance. We started our employee resource groups in 2008. The catalyst for the creation of our groups, we had a particular HR director whose husband died very tragically in an accident. His husband was not out to his family. So he received a phone call from his partner's family and was asked to come. Part of his experience in that was very impactful to him with the experience of not having been out to the family. And he thought about how that impacted his experience within the workplace because he was out to some of our colleagues but not to everyone. He learned about the existence of employee resource groups from other organizations and thought, Progressive actually has a very open and inclusive culture. Why don't we have these here? So he did some research with some colleagues that he had with Deloitte & Touche and wrote a white paper that was presented to senior leadership within our organization. And we started with 2 employee resource groups in 2008. We now have 9 in an organization of approximately 26,000 employees. More than 10,000 of our employees are members of employee resource groups, and we have 1,500 people who are members of our LGBT+ employee resource group.
Paul Clark, what's the PNC experience?
So we started our groups about 5 years ago, almost 6 years ago now. And in Cleveland, we have 4 groups that I'll call local. And then we also have really great access to 2 groups that are more corporate and more virtual. The local groups that we have are our LGBTA group, and many of our leaders and members are here with us today, which I appreciate. Thanks. We have kind of what we call an emerging professionals group. It's really a YP group, but emerging allows for hopeful people like me that have a few years left yet ahead. So it's an emerging professionals group. We have a women's EBRG. We call them EBRGs. We put the B in there for business, so Employee Resource Business Group. And then our 4th group is an African American group, which was actually the first group that we started here in Cleveland. Virtually, we have 2 groups. They're corporate-wide. You access them through our PNC intraweb, although much of the leadership of these next 2 groups reside right here in Cleveland. Those 2 groups are PNC Cares, which is a disabilities issues group, and a veterans group. We call them military group, so it's for families and veterans, and we have usually 20 or so people who are deployed at any given time. So it's a great support group for them. Great leadership of the groups, all of them. We have 5,000 employees that work for us at PNC here in Greater Cleveland, and roughly 1,700 or so participate in at least one of the EBRGs.
Jason, what about over at KeyBank?
So we are one of 9 groups, 9 ERG groups, which cover young professionals and a veterans group that we have. The LGBT group has been in existence for 9 years and is part of a larger diversity and inclusion umbrella. It is corporate-wide. We have about 165 active members. Sounds kind of small when I hear 10,000. However, the dynamic obviously in retail banking is we actually have to cover off on branches as well, of which we have over 1,000. And so the ERG groups are voluntary participation. Often they happen in work hours, so we have that dynamic that we have to deal with. Similarly to everybody on the panel, I think the genesis of the group was to create a space where like-minded individuals could discuss issues pertinent to them in the workforce, to feel a sense of inclusion, and to, with the support of some great executive sponsors, Paul Harris is here today, who is our executive sponsor, start to table issues that were relevant to the LGBT community within the workforce, support pride events in the community, and become part of an external face of the brand in the communities in which we serve.
Have you discovered that there's a difference amongst all of your employee resource groups? Have you found there's a difference between the LGBT ones versus the other ones?
Well,
what's distinctive? Kellie?
I think when you look at our LGBT group at the clinic, I failed to mention ours has been in existence formally for 9 years. And, the legend has it, there's been a group who's been meeting for 20 years all along the way, but formally it's been 9 years. But I think that this group is really unique in that it really represents just a diagonal slice of any organization. So really it crosses all demographics when you think about it. Male, female, young, old, Asian. It doesn't matter where you're from, but it really represents, in my opinion, most of our caregivers and the patients that we serve, the diverse patients that we serve in our organization.
What do you think, Paul?
Yeah, a couple of things I think are distinctive about our LGBTA group at PNC. Maybe three things. And the first would be, and this might be because of the self-identification nature of that particular group versus others, and we have roughly 100 members, but the core group of really actively engaged members is the highest percentage. So there's 80 really fully engaged members, and probably the other 20, Jason, to your point, are working in our branches, and it's a little harder there to become engaged. But and some of the other groups we have, and I'll take our emerging professionals group as an example, we might have 400 members, but there's 40 or 50 people that are fully engaged all the time. So the core engagement's much higher for this group. The second thing is I think it's attracted the best leadership we have of any of our EBRGs. And three of those leaders are here. Ken Angemeyer is here, and Emily Schaefer here, and Alan Thomas is here. And they have pushed us to get better. And they have pushed us on issues in a way that the other EBRGs have not. And we've benefited from that, just not only in thinking about our own diversity and inclusion efforts, but just being more inclusive really in everything that we do. So I think maybe for those two reasons, they're very, very different and very, really, really helpful. They've really accelerated the work that we do.
When these groups came into being, was there a tipping point where suddenly there was a discussion was generated within the organization saying, it's time we need to get together and do this? How did you make the decision?
I don't know that there's look, where more than two people are together, that's a community. So I think that there's a recognition and a support network that says there should be a women's group, there should be a Hispanic group, there should be an African American group, there's a veterans group. I think they get started because two or more people come together and say we can be a force for good, and you have a brand working for Key that is accepting and open of that to say, yes, we want to learn, to Paul's point. We know that we need to potentially be more progressive in certain areas. Help us get there. So I think, I don't think anybody waved a magic wand 9 years ago and said you need to go and create a group. I think, but over time, groups spring up because, again, there's this common sense of community that when a couple of folks come together, they can be a force for change.
Does the HR department, are they involved at all in the creation of these groups?
It is not an HR mandate at Key. Again, I think that it's heavily supported from an HR perspective under the umbrella of diversity inclusion, but it is not run by an HR department. It is run by employees, that run the gamut of roles across the business.
Same experience with the rest of you?
Yes, and that's the same experience at Progressive. Our employee resource groups do technically report up through our HR organization. We have both employee resource groups, which are grassroots groups that are staffed, managed, driven by employees who are interested in the particular demographic and what the experience for that demographic is in the progressive workplace. We have diversity councils that work in conjunction with our employee resource groups that help employee resource groups figure out how do you be effective within the different lines of the organization. So you were talking about the experience of how do you interact with people who are in your branches. We have similar experiences at Progressive in that we have maybe 6 large contact center sites, but then we have 12,000 employees who are in smaller individual claims offices. So how do you interact there? And our diversity councils help us achieve that level of interaction.
You all represent organizations that are, hundreds, if not thousands of employees. Do you have advice for the smaller organizations? I mean, because there's obviously an organization that only has 100 employees may not have something like this. How do you integrate that?
I think my advice would be if, clearly if there's a need, like you mentioned, if 2 or more come together for a common cause, somehow connect it back to the mission of your organization. So for like us in healthcare at the Cleveland Clinic, the work that we do in all of our ERGs, particularly with the LGBT, is really being connected back to how do we provide better care for our patients, look at the prevention and the wellness. And again, that's the mission of our organization. And it provides meaningful work.
And the thing I would add to that is, and I think this is a Cleveland thing, because I talked to my colleagues, my counterparts in Philadelphia and in Pittsburgh and kind of northern New Jersey, similar markets to Cleveland. And it only happens here in Cleveland, and that's all of the employee resource groups at any particular company seem to network with those of other companies very easily. So you may be a company of 100 employees, and you can begin a small group, but that small group can be part of a much bigger effort around the whole city. So I think size might not matter as much as the size of the company might not matter as much as you'd think, because there's so much support that even a small group can get for the work that they have to do.
How has this work, forming this group, how has that been for you personally? How has this, the presence of this
Oh, my
group
goodness.
within PNC, how has that impacted you? How has that changed maybe your perspective or something?
I'm sure I'm going to get some snickers and smiles from my friends at the table because they've seen me. It's just been, and I can only speak for myself, but I think I get to the point in my career where I almost forget that I have blind spots. Earlier, I seemed to know that I had them, and I'd look for them. But somewhere along the way, I kind of figured, I must have covered them all somewhere. And this work reminded me in very clear terms that, boy, I have a lot of blind spots, more than I ever thought. And all of the groups have helped me rethink who I am. They help me rethink who I want to be as a person.
Mm-hmm.
They help me rethink who I want to bring to work every day to try to, lead by helping people achieve what they want to do at work. So it's been fundamental to my development.
I would agree. I think we were having a little chat before the luncheon, and we were talking about sometimes when we think we're inclusive, we're really not, because we don't recognize when we have those blind spots. And so for me personally as a leader, I think it's really allowed me to be more transformational in my thinking and really to have a more engaged voice at the table when we're looking at decisions that will really impact not only our 43,000 caregivers, but really all of the patients in the communities that we serve. So I really look at it, it's been a gift for me.
I think, I was one of those 50% that wouldn't come out at work because I felt that it would be a cap on my career. This is not at Key, this is at a previous employment. And I think tapping into people that actually give you the confidence to be your authentic self and to represent who you are, especially as a leader, is really, really important, because that's what folks that report to you and are looking to you as a leader expect, is for you to be your authentic self, because it enables them to be their authentic self. And the other thing that I would say, to Paul's point, is the person that replaces me at Key might not look like me. It might be a black trans male tomorrow. And so having that conversation within an organization to say that you have to look further beyond the boundaries of where you look today, and you have to embrace that, is really what I think an ERG group helps prepare an organization to do.
When we talk about inclusivity, we also have the allies. What's been your experience in terms of the allies, in terms of being parts of these groups?
So I can talk about that from Progressive's perspective. We have always welcomed allies within any of our employee resource groups. So part of our messaging around inviting people to become members is that you do not have to be a member of the demographic to join. Part of that messaging is geared toward part of how we really impact other people within the workplace is helping them understand sort of our unique otherness, or the things that make us us, so that when you're interacting with peers, colleagues, leaders, that they understand all of what you bring to the workplace. One of the reasons that I feel very comfortable and I'm very proud to be an openly out leader within the Progressive organization is that by having openly out gay leaders in the organization, the people who come behind me and new employees who come in and they see the strength of the LGBT employee resource group that we've created, it helps make them more comfortable. I've had individuals who've contacted me to say, I'm new to Progressive, I've only been here for 3 months, I've never felt more welcomed in a workplace, and that's part of, for me, what makes the difference in this space.
And isn't that long the story of any underrepresented group? If they can see a role model, suddenly they're inspired and things change.
Clearly, I think it impacts not only the engagement, but really the productivity. I mean, you shared some statistics at the beginning. Clearly it makes a difference.
Talk about statistics, but going back to that Human Rights Campaign report, it's called The Cost of the Closet, and they say employee engagement is key to retention and productivity. But here's some numbers. A recent California study showed that when a person acknowledges and comes out to a team, the team is 27% to 35% more productive. Hiding and covering identity can detract from team productivity. Panelists, what have been your experiences along those lines? In terms of the team building aspect of it, it's like, yeah, the people are out and when they're talking and they're open to each other.
I'd offer two thoughts. One thing that we have a lot of work to do is just to have every employee meet every other employee where they are and not make broad assumptions about people. So, one of the challenges I think of the employee resource groups is you tend to think, well, this is the African American group and they're doing this, and this is the LGBT group, they're doing this. But the fundamental learning for me, and I think for others, has been you got to really meet people where they are.
Right.
And I think to the extent that you bring that into a work team environment, the team will be more productive. Jason mentioned authentic self. I think that's spot on. I think to the extent that you can bring your whole self to work every day, the entirety of who you are, you're just going to be more at ease, more effective, more listening, and you'll have a better work product. I think back to the allies for a second. I think as we work and continue this journey on diversity and inclusion, and we have a big path ahead of us, but as we continue that work, I think what the best part of being an ally is that you begin to understand you've got to meet people where they are. Right. And boy, if we can spread that, culturally, if you will, through our company, we're going to be a lot better off.
We've been painting a very bright picture of the benefits of these groups and the way it impacts productivity and such. But how about some challenges in implementing these groups and the larger culture of the corporation? Have there been problems, things you've bumped up against? Anybody on that?
I don't know, again, I'm relatively new in the role of the sponsor, so I really can't speak to the history piece, but what I can tell you is an opportunity as opposed to a challenge is that I think each of these ERGs, one of their goals and mission is to really educate our workforce. So whether you're in banking or in healthcare, to create that awareness. And at the end of the day, you really want a competent cultural workforce, don't we? And so I think that's part of the mission. And so I think that's an opportunity because people aren't always welcoming of new ideas and new education. So I think that's a challenge or an opportunity for us.
And how have you met that challenge?
So many of our ERG groups clearly, from the clinic perspective, have reached out to the community to do education, support different events. Mm-hmm. When you look specifically at our LGBT community and our ERG group, we've done a lot of things to support internal education. So for example, last year at our main campus, we completed and passed the Health Equity Index Survey. And that was really an attempt to educate our frontline caregivers on more of an awareness and have that cultural competence. And so right now we're working on the rest of our health system to complete that survey as well.
I would add, I think that I think this is an oversimplification, but if you track ERG groups, particularly from an LGBT perspective, you're going to see them impacted dramatically by what happens in the macro environment. So I think the dialogue that we have in companies and in corporations now is positively impacted by the fact that we have marriage equality. And I think the opportunity is we should not stop there. And the reason I say that is because if I think back to 10, 15 years ago when I was talking, when I was in an ERG group, it was an inside the ballpark conversation about attending pride events and, making sure that we had the same tax treatment on health insurance. Many of those things have now dissipated, and now I think we have to have a conversation which actually is broader than just what's going on for the LGBT ERG group. What's the definition of family? How does that impact how large corporations think about that? Where are business opportunities? The purchasing power of the LGBT community is nearly $1 trillion. What are corporations doing to meet the needs of clients that may not be walking into the branch and putting up their hands and saying, hey, I'm wearing a pride flag, but there needs to be a sensibility there. And then ultimately, who are we going to hire? right? From a wealth management standpoint, for Paul's and my companies is a perfect example. There's billions of dollars of wealth amongst LGBT folks out there. What are companies doing to recruit people that can have an LGBT-based conversation as much as they could have a conversation with a straight couple that is 10 years from retirement? So I think the dynamic of the conversation, the environmental changes are enabling us to have a very, very different conversation and to spur that as part of as leading an ERG group.
Now, the challenge we've had has been with kind of frontline managers, especially in a production environment. So it's kind of an extension of people working in the branches having a tough time participating fully during the course of the day. And there's some managers that are blockers, there's no doubt about it, and they aren't very creative about how they can free people up to participate and be engaged. And so we do carrot and stick type stuff to work with that.
And how do you decide what to do? I mean, how do you analyze each situation? Is it, and it's within the group decides to do that and to come up with the carrot to put on the end
Yeah,
of that
and
stick.
they always do in a remarkably creative, cool way.
Let's look more globally. What impact has your ERG, the LGBTQ ERG, had on the corporate culture? What have you seen? The fact that the existence of this group has changed something.
So I can't talk specific to LGBT, but I can talk more generally about progressives culture. So we do an annual culture survey or organizational effectiveness survey. One of the questions that we measure on that is whether people feel included in the workplace and whether they value the diversity and inclusion work that is going on within the organization. We're then able to map that data back to whether people are members of our employee resource groups. And on questions that are gauging their sort of overall engagement in the workplace, their satisfaction within the workplace, and whether they intend to stay with Progressive, employees who are members of our ERGs track higher on those data points. So while I can't draw a direct correlation between LGBT and those data points, I can draw that correlation between employee resource groups overall.
And I think the impact that it's had at our organization, clearly they've been able to impact the same-sex domestic partner benefits, and they continue to work on looking at any policies that we have to ensure that there's equity and inclusiveness across the board. And so they're really a powerful group to reckon with, and many of them are here today as well.
Daniel is going to come up and talk about some mid program, and then we will go open to questions. So you've heard what everyone has to say. Daniel.
Thank you very much, Mr. Barnett. I'm Dan Multhrop, Chief Executive here at the City Club, also a proud member. Today we are participating in National Coming Out Week with a panel conversation about fostering inclusivity in the workplace, featuring Paul Clark of PNC Bank, Kelly Hancock of the Cleveland Clinic, Kellie Rubesne of Progressive Insurance, and Jason Rudman of KeyBank. David C. Barnett, WCPN Senior National Coming Out Week reporter. Dave is our moderator. If you're joining us via our webcast and would like to tweet a question, please tweet it at the City Club. If you're too shy to ask it yourself here in the audience too, you can also tweet it at the City Club. We welcome all of you here and those joining us via the web stream, which is provided by our primary media partner, 90.3 WCPN, WVIZ PBS, 104.9 WCLV Idea Stream, or one of the many other radio stations across the region and country that carry City Club programs. Production, distribution, and broadcast of City Club programs are made possible by Cleveland State University and PNC. Be sure to join us next Friday, October 23rd, as we welcome Dr. Peter Capelli from the Wharton School of Business at the University of Pennsylvania. He will be asking and answering the age-old question, is college really worth it? For information about our upcoming and past forums, please visit us online at cityclub.org. I'm serious, that's what it's about. Don't laugh. Our community partners for today's program are Equality Ohio, Facing History and Ourselves, and Plexus, the Chamber of Commerce for the LGBT community and allies. We thank all of you for your partnership. Additionally, we welcome guests at tables hosted by the Cleveland Clinic, GE Lighting, KeyBank, Medical Mutual, Morgan Stanley, PNC, and the Lubrizol Corporation. Thank you all so much for joining us today. We welcome students from St. Ignatius High School to today's forum. Student participation is made possible by a generous grant from the Loeb Foundation. We thank them for their support. Will the students please stand to be recognized? And now it's time for the City Club Q&A. We welcome questions from everyone, City Club members and guests alike. Holding our microphones today are our City Club Assistant, Wesley Allen, and our Marketing and Outreach Fellow, Faye Walker. Do we have our first question, please? He's in the middle. Somebody's going to get there first. It's a race.
So regarding your domestic health care policies, I'm wondering how they've been affected now that we have marriage equality in each one of your organizations, not only among the LGBT community, but domestic partners that were also heterosexual. If you can comment on that, I'd like to hear.
So I can talk about Progressive's policy. Our policy is that as of January 1, domestic partner healthcare benefits will only be available to employees who are legally married.
To my knowledge, we haven't made a change yet.
Same thing. I don't think we've made a change yet.
Jason?
Same thing.
Same thing. We have another question there.
Yeah, what you're doing with these groups really sounds great. Do you see in the future, as the economy grows more internationalized, something like this starting for foreign-born employees?
Well, I'll take that. Thanks for the question, Michael. You know, we have different cities, so we're kind of a franchise that's east of the Mississippi River. So in different markets, we have a different mix of employee resource groups. For instance, in Chicago, we have a big Asian group. In New Jersey, we have a big Latino group. And groups bubble up, right? The experience that I've had with the groups we have here in Cleveland is, as much as the market leadership would like to think that we had an idea to do these, it all bubbled up from the 5,000 people doing the work every day. And interesting groups form. You know, it's a group of two, and it grows from there. And you know, whether it's international employees, many of whom work for us here in Cleveland, or it's another affinity group, if you will, I would fully suspect that that would happen. I really look forward to that. I'm excited to see what could happen in the future.
I would just add, again, I don't think a wand gets waved and somebody says, oh, you know, go forth and multiply and figure out, you know, what you're going to do. I think the best examples are where it is truly organic, and folks see a need or a gap that they actually want to address and fill with the organization.
I agree. I think it is organic. I think, you know, as our organization continues to expand nationally and internationally, I think that's something that will just happen on its own.
Next question.
Hi, my name is Mary Zoller, and I work for Equality Ohio, and I formerly worked for the Gay Games. And I want to just say that through the ERG groups, we did so much for the Gay Games to help bring this community together and strengthen the LGBT community as well as the larger community. I also want to give a shout out to Plexus, because Plexus has been working so tirelessly for many years. Used to have a different name, has formed to be Plexus, and to really form the ERG groups. And one last thing, with Equality Ohio, we have something called Ohio Business Competes, and it is a sign-on letter that we are preparing to then show to the legislators to say, hey, the businesses in Ohio believe in non-discrimination, and that will go a long way to changing the discrimination laws in Ohio. We're one of 28 states where it's still legal to fire someone for who they are. So I want to thank you all for your participation, and if you have any thoughts about the Ohio Business Competes or that kind of non-discrimination sign-on, I'd love to hear them.
Well, Mary, I think we all ought to work hard to try to get the Gay Games back. Yeah. I know that happens like every generation or two, but
Right.
you know, for a lot of different reasons at a lot of different levels, it was an incredible couple of weeks, really. And for us, I think at PNC, I think it lifted all of our work around inclusion to a whole different level. It was just a remarkable week, and so many people participated in it, and we learned a lot. We'd like another try at really engaging with the Gay Games when they come back.
Yeah, I would agree.
Another question.
Back there.
Thanks. So I work for the Cleveland Clinic, and it took me a good number of years before I felt comfortable coming out. And the main reason was not so much that I feared retribution from anyone that I worked with. It was more so that I see patients in a community where I'm not sure that that would be accepted. And now I'm old enough that, I don't care. I'm going to, accept me or don't, here I am, right? But but I wondered, particularly Kellie, because we deal so personally with other people's lives. Do you have any knowledge or experience with patients who have refused to be treated by people because they recognized that they were LGBT, or situations where employees felt that they were being discriminated against by their patients?
Well, thank you, Deb. That's a good question. And you can see Deb's not shy. I know it's hard to believe. But you're right. So as we look overall at the experience of our patients and what we hear from our community, what we do know is that you're exactly right. We have heard some things through our ombudsmen, from our patients and their family members, where at times they don't feel comfortable. And you're right, as you mentioned, healthcare is very personal. And you really have to establish those trusting relationships with your providers and those who care. So I think that the work that we're doing in our organization to create that awareness and the continuing education will only allow us to serve our patients and one another better. But you're absolutely right.
And for members of the audience who maybe don't have an ERG in their organization, or someone who's watching now, here's some interesting statistics. About a third of LGBTQ employees feel compelled to lie about their personal lives while at work, and 53% nationwide hide who they are at work. So there's obviously more work to do. More questions? Right over there.
I also work at the Cleveland Clinic, and I was intrigued by both Paul and Kellie Hancock's comments about the power of the ERGs in terms of changing corporate thinking and even impacting policy level, which I've seen and been pleased to be part of at the Cleveland Clinic. I'm wondering if, among the various panelists, have you seen that, following up to the gentleman's question about domestic partner benefits, health benefits, in terms of health care benefits for LGBT, and particularly the T individuals, if those are considered covered services under your health plans?
Also, as a bank that's received a perfect score from HRC for 7 years in a row, one of the questions is you actually have to provide benefits for trans in order to get that 100% score. So that's an absolute affirmative from Key.
And the same for Progressive. We've offered trans-inclusive medical benefits for 3 or 4 years now. Our employer resource group was actually impactful with that by informing our HR and benefits organization about the importance of offering trans-inclusive medical benefits, tracking changes within corporations about making those medical benefits fully available. So while we were not the decision makers, we were the educators in that area.
And we do as well at PNC.
Hello, my name is Luz, and my question is around how the ERGs impact new talent coming to your organization. We've had a lot of dialogue about existing employees and inclusivity, so just curious on that.
That's a great question. So I can speak to our organization. Whenever we onboard a new caregiver, no matter what you do across the organization, we provide you an opportunity to really ask questions about the different ERGs, and we give you, all the education and the information you need to be a part of that.
So, go ahead.
I was going to say, Progressive does the same thing. Part of the work that our employer resource groups and our diversity councils have done was to create educational material, work with our HR and benefits organization that create the onboarding and training materials when we bring new employees in. So we include information in the onboarding experience about all of our employee resource groups, as well as broader education on the concepts of diversity and inclusion, trying to help people understand about the concepts of blind spots, about the fact that we do intend to have a fully diverse and inclusive culture, and talking about sort of what inclusivity means, because people come in with all sorts of different backgrounds, so trying to do a little bit of level setting when they come into the organization is helpful.
And as somebody that moved to Cleveland 15, 16 months ago with my husband and our now 2-year-old from Manhattan, I would be remiss, because I'm sitting here right now on the shoulders of the work that Bill Spence has done on behalf of the ERG group. And indeed, Bill was one of the first people that I met at Key, and more importantly, helped with the transition of moving from the big city of Manhattan to the wonderful city of Cleveland. And what was great about what Bill did is it wasn't simply checking a box on behalf of the ERG that said, oh, you're a gay man, that's good, we can check that box and do all of that. It actually was a very, very specific, diverse interpretation of all that the city has to offer and all that Key has to offer, embedded in the principles of what diversity and inclusion at Key really means.
I'm always struck by the very cool attitude of my children. I have two sons, one is 21, one is 20. Our 20-year-old is gay, and he always wonders when I talk about this work that we do at the bank, well, what do you do that? What do you have those groups for? What's that all about? And it always provides hope and encouragement for me. But you know, we're not going to hire a diverse and inclusive. We're not going to hire a diverse workforce until we can have diverse groups of people hiring them. Yeah. I have a tough time hiring people who don't look like me, and I get it. So you know, our big journey on diversity and inclusion is to make sure that we've got a diverse and inclusive group of people who can then go into the community and hire the best talent that there is. It's the only way it's going to work. So these groups are really important to spark that, to catalyze that, and make that happen for us.
A question over here.
Hi, my name is Alvin. I'm that husband of Jason. So while I appreciate the conversation on inclusion and diversity, do each of you think that your brands or your organizations are actually walking that walk as far as consumer engagement in your advertising and your marketing? And if that's not happening, how can your ERGs influence that?
No, in our case. The EBRGs have indeed begun to move that. And the proof point I would offer to you is I want to say this the right way, I'm not a marketing advertising person, but the ad that we have recently run nationwide that has garnered the most clicks online, the most eyeballs through other media platforms, is a lesbian couple sitting on a couch watching, I assume, Homeland and eating popcorn. And it has been by far the best ad that we've ever run in as long as we can remember. So there was certainly the EBRGs helped move that, and boy, the proof in the pudding was immediate. So we're very encouraged, and you know, I think we'll have accelerated work in that regard.
And I'm not a marketing whiz either. But I think clearly we have opportunity as an organization. You know, we do a lot right now, as I mentioned earlier, with community outreach and really getting out there and support different things. But I think from a marketing standpoint, to represent all the ERGs, I think always we'll have some opportunity to work on that.
Within Progressive, we previously have done targeted marketing to the LGBT community through Faces of Pride events at like 7 of the largest Pride events that happen in the country, as well as some targeted print advertising. Our experience in sort of measuring the effectiveness of that, we didn't get the return on investment. We do have sort of a seat at the table within our marketing organization where when they're creating new materials, they will reach out to contacts within our employee resource groups, ask us to come in and do, a recent example is they were doing a new campaign on cohabitation or coupling, people who live together but that aren't married. And they ask us to do a focus group with people from our LGBT employee resource group so that we can provide that lens on the content that they're doing so they can understand, are there blind spots that from a marketing and advertising perspective they may not have, but that we can lend to the work that they're doing. So we continue to work and build those relationships so that even if we're not doing targeted marketing to the LGBT community, that we're adding that lens.
What about you, Jason?
Well, I didn't know that question was coming, by the way. I do want to point that out. So I do not have a canned response. So I think like everybody else, we have an opportunity. You know, Key has branches from Alaska to Portland, Maine. And I think that the opportunity that I do believe that the ERG can continue to do, and that conversation has started, is to look at the regional differences. We support Pride. We were a sponsor of the Gay Games. I do think that there is more opportunity and more things that we can do. Again, coming back to the purchasing power of this community, and it would seem silly to run away from $1 trillion in purchasing power and billions of dollars in wealth. And so I think there have been instances, if you look at some of the great brands that have, even before marriage equality, said, I'm going to place a bet there because I know it's the right, it just makes corporate shareholder sense. And again, it represents, I think, the communities and the employees that we're serving on a day-to-day basis.
Another question?
I'm Yusuf Abdul Karim from St. Ignatius High School. I'm the president of the Multicultural Student Union there. So from that perspective, I'm kind of curious as to how often the LGBT ERG groups work with other ERG groups, such as like the African American ERG groups, to promote like not only LGBT issues but diversity awareness issues as a whole.
Well, I'll jump on that, and thanks for your service at St. Ignatius, and please accept the fact your answer is coming from a St. Ed's graduate. So quarterly, we bring together the leadership of all of our EBRG groups for a couple reasons. One, we want to make sure events are coordinated, both from a calendar standpoint and kind of a theme standpoint. We want to make sure that kind of best practices around gaining new members and engaging the membership, growing that core, fully engaged membership. We want to make sure that those practices are spread around. We get great ideas, just bouncing off of one another, and the pluses and the minuses, the wins, the successes and the failures of things that have been tried. So it's a really important part of how we try to grow all of our EBRGs and continue their effectiveness and their growth and their influence within our company.
I would agree. So I also want to thank you, and I'm a mother of a St. Ed's graduate, so I'll answer that as well.
Sorry, guys.
We didn't plan it. But I think there's a lot of work that overlaps between the ERGs, and I think we provide a wonderful opportunity for others to exchange those ideas, whether they're invited formally or informally to the different committees and meetings. And it's really an opportunity to spread best practices across our entire health system and continue to grow in that area of work.
At Progressive, we're actually much more intentional about our collaboration. So we have 9 employee resource groups. Each group has a chair or a leader for the particular employee resource group. We all meet monthly, and then we also do collaborative annual planning. We align our work to enterprise-wide diversity and inclusion priorities. One of the efforts that we're working on for 2016 actually ties back to some comments from a prior panelist about challenges with engagement in middle management. So across all of our employee resource groups, we will target our middle managers next year. So we then align up through the organization for the overall D&I priorities. We align across all ERGs with the activities that we're planning so that we can identify synergies. And then we do the individual work that's meaningful within our individual groups as well. So we are very planful about that. And sometimes it happens, within that structure. Sometimes it's serendipity that somebody's talking about something else and I hear that and I'll reach out to them because I've been able to build a relationship with them in that context.
Mm-hmm.
Another good example, I think, is that speaks to your question, is as we plan PNC's engagement and involvement in the convention next year, a big part of our planning group includes the leadership of several of our EBRG groups. And they provide a perspective, they provide a filter for thinking through things that's just incredible and really needed as we think about fully engaging in the opportunities that convention holds for our clients and for our employees and all the different partners that we have throughout the community. I also think that example speaks to the influence that the EBRGs gain quickly in our company. So we don't think about big things without including them now, which we didn't do 3 or 5 years ago.
So thank you all so much for participating in this panel today. It's you're revealing a lot of the invisible glue that holds your organizations together and allows them to thrive, and I think that's a really important message for all of us. In David's introductory remarks, he talked about some of the lack of legal protections for the LGBTQ community, and it's no doubt the lack of those legal protections is of concern to many of the ERG and EBRG members. And I wonder to what extent you find that your groups are activating themselves to participate in the political process and educating state senators and state representatives who are in a position to actually affect the kind of change that groups like Equality Ohio are pushing so strongly for.
That's a great question. So we're very fortunate at our organization to have a very dynamic chief government relations officer who happens to be in the audience today. And she is very active with our ERG groups and clearly reaches out when there's anything hot on the agenda, if you will, or to try to be proactive, to really engage those frontline caregivers in that discussion, to really provide feedback so we can make some sound recommendations as we move forward. And so that is one of the venues that we use through her office.
I would just say, I think as an evolution of what an ERG represents and how it can be a force for good. In conversations with Paul Harris, who's our executive sponsor, there has been an explicit conversation about public policy, how we would respond, again, how we might push the dialogue forward here in Cleveland, and again, thinking about the footprint that we represent. Are there local issues that we need to be on top of? How would we react to those? What's the path forward? So I think it is, Dan, to your point, increasingly an opportunity for the ERG to be keep their finger on the pulse and be that listening post to say, now what about this? How do we do this? How might we react to this?
Another question.
Hi, my name is Philip Morgan at St. Ignatius High School. Previously, it was mentioned that 53% of your employees have not come out yet. And what do you all think that you can do at your workforce to make your employees feel more comfortable to come out and have the courage to do that?
You have to show up. I was, again, I kind of relayed that, early in my career, I did not, I was fearful of coming out because I did not think that representing my whole self in the workforce, mind you, I've been together with my husband for 17 years, so it's that whole craziness, and I lived in New York. Go figure. You'd figure New York, you could pretty much, if you can't be out in New York, where the heck can you be out? But I also think part of it is, again, I grew up in England, and in England, just a very, very, very different experience. You transplant an Englander even into New York, and I think it's about the shared experience and standing up and saying, being your authentic self and really showing up. I think the other thing, and it goes to what Paul said, we as hiring leaders, we as leaders actually have to be more diverse in our hiring practices. So similarly to creating an environment where somebody that is trans can believe that they can achieve to their best potential, it is similar for Hispanics, African Americans, women. You could just go down the list. We have to hire a diverse and representative workforce so that folks that come in, the new leaders of tomorrow, see folks and experience folks that are who they are. And only then will we actually be able to take that 53% number to 0.
For some managers or supervisors who may be listening out there, here are the top reasons for not being open. 23% impact on advancement and development opportunities. 31% loss of connections or relationships with coworkers. 36% fear of being stereotyped. And 38% fear of making people uncomfortable. Food for thought. Another question?
Hi, I'm Maurice Ware from Ignatius. And for students that are planning on approaching the workforce in 6 to 8 years, where do you see ERGs and their impact then as opposed to now? And what do you think they will hopefully expect to see entering the workforce?
Hopefully we put them out of business. Right? I mean, if we do this right, you wouldn't need an ERG because this would be common conversation. I don't think that's going to happen in 6 to 8 years. However, we're making a lot of progress across all dimensions. So I think it is, again, from my vantage point, I take my cues from the macro environment. I think we're on a path that is irreversible in some regards around treating the populace in a more diverse way, respecting diversity in all of its forms. And I see the purpose of the ERG groups evolving along those lines. It would be great if in 8 years, when you get into the workforce, they don't exist. That should be something perhaps we should all take on as leaders.
I would agree. I would think too that, you know, over time, our hope is that we wouldn't have them anymore. We wouldn't need them anymore. But I think by the time you enter the workforce, you'll see more mature organizations. And my bet is that you'll see many of these leaders in these ERGs be the leaders of these organizations. And that's what you would want to seek out as looking for new employers.
So the other side of the coin is, as you're thinking about, as anyone is thinking about what you might do from a leadership experience in high school and college, that will prepare you and have your resume be prepared to distinguish yourself as you're in the job market search. You know, leadership in employee resource groups, I think, is an awesome thing to have in your experience.
Similar thoughts at Progressive?
Yes, actually very similar thoughts at Progressive. I mean, ideally long-term, we would like to not need employee resource groups in any way, shape, or form, because we would have created a culture within our organization and hopefully a broader, across the entire sort of societal culture, where we can all accept people for who they are and all of the different elements of otherness that we bring with us, and that would be done by meeting people where they are with no judgment. And that when I see you, I'm not making assumptions about who you are, your knowledge, your skills, your experience. I'm going to allow you to inform me about those things. But I think that's very aspirational. I think that's sort of what we all work toward in the long term, but we have to continue taking the steps that we're doing in the short term to lead toward that goal.
That's Kellie Rubesne. Next to her is another Kellie, Kellie Hancock. Paul Clark is here. Jason Rudman there. Thank you all for having a very stimulating conversation today.
Thank you.